Talk to us about what trends you're seeing when it comes to testing, when it comes to vaccines, as we confront this really dangerous and scary Delta variant.
So thank you for having me, Emily. Unfortunately, we are seeing very high COVID positivity rates after a time frame where it was feeling like we had controlled it. With Delta variants, but the overall positivity rate is high. But what we are seeing is among the vaccinated adults, there are some breakthrough cases, but it's fairly small compared to the rest of the population. And I think we also are seeing a lot less severe symptoms among them. So I think that I would still echo the same guidance. Let's get as many people as possible vaccinated. And Carbon Health has been in both in the front lines of the pandemic. We have finished 1.5 million vaccine administration, and we are hoping that the remaining population will also see the need for doing the same.
Are you seeing anything specifically regarding the latest surge? I mean, do you see vaccines slowing down? Do you see positive test results clicking up?
So the positive test results are really just growing very fast right now. And actually, one of the patterns you are seeing is Delta variant becomes transmissive a lot faster. So which means even if you have some antibodies, people are still showing positive tests. But again, if they're vaccinated, we are now seeing a lot of kind of concerning symptoms among them.
Now, you grew up in a small village in Turkey, and I know that your upbringing is in part what inspired the vision to start Carbon Health and make healthcare more accessible. What is the vision, and how close are you to getting to where you want to be?
So our vision, our mission has always been making high quality healthcare accessible to everyone. When I came to this country as an immigrant, I was pleasantly surprised with how good the healthcare experience was, but only for the high-income people, only for the wealthy. And if you look at the healthcare experience of an average American, it's arguably worse than a lot of even developing countries like Turkey. So, I thought the technology companies were not doing enough to really help average Americans' healthcare problems. And we started Carbon Health from the first day with an obsession to making care better for average Americans. And what we have achieved is we now have the sort of experience that someone who's in the top 1% is still considering as a really high quality to consumer experience, but then in a way it is accessible to people living paycheck to paycheck. So the main goal of the company is becoming the first nationwide primary care provider. We have recently closed $350 million in financing, as you guys first, I think, shared. So we'll just grow that. And the other thing we are working on is doubling down on this concept that we call omni-channel healthcare. We have had clinics, we have had telemedicine providers, we have had consumer devices and more, but nobody has really integrated these different modalities in a way that truly reduces patient friction. That is the core product vision of Carbon Health that we have been investing in.